Good evening and welcome to tonight's talk on microvascular disease or diabetes. My name is Dr. Renson Kitari from Kenya. And this is the outline for our talk. We look at the global burden of diabetes, these factors for microvascular disease, types of microvascular diseases, management, the take-home message, and a conclusion. In terms of the diabetes burden, it's a global pandemic, currently affecting 507 million people worldwide with a prevalence of 10.5%, meaning that 1 in every 10 people have diabetes. We are looking forward to having about 783 million people by 2045 with diabetes. And the risk factors for diabetes complications, these include poor blood sugar control, long duration of diabetes, uncontrolled hypertension, obesity, dyslipidemia, smoking, and alcohol use. When you look at this picture, my dear audience, it looks at the all complications of diabetes, both macrovascular and microvascular. The main topic of discussion this evening is on microvascular disease, touching on the eyes, the kidneys, and the nerves. But it's good for you to also take note that poorly controlled diabetes could also give to large vessel disease, so that patients will present with strokes, with heart attacks, and peripheral vascular disease leading to amputations. And microvascular diseases, as I have written there, they include the retinopathy, the nephropathy, and the neuropathy. And the key important health message that I would want to pass across here is that high diagnosis and early medical intervention is key to prevent disease progression and these complications that are expensive to treat, that end up also interfering with the quality of life of our patients. Diabetic eye disease, it's also called retinopathy. And diabetes is the leading cause of partial or complete blindness, and 1/3 of diabetic population has retinopathy. That's about 180 million people currently. A major risk factor for diabetic retinopathy is poor glycemic control, and pregnancy increases the risk of diabetic retinopathy. For diabetes kidney disease, also called nephropathy, diabetes is the leading cause of kidney disease, and 1/3 of diabetic patients have diabetic kidney disease. And it's also good to appreciate that 75% of the patients on dialysis are diabetic, and kidney disease is associated with adverse pregnancy outcomes, and pregnancy also worsens existing kidney disease. And optimal control of glucose, hypertension, and avoidance of harmful drugs is key to prevention of diabetic kidney disease. For the diabetic nerve disease, also called neuropathy, it's good to appreciate that diabetes is the leading cause of nerve damage due to poor glucose control, affecting about 50% of the people with diabetes, causing debilitating neuropathic pain, numbness, tingling sensation, muscle weakness, abdominal upsets, palpitations, and reduced sexual function. It's a major risk factor for amputation and reduced quality of life. In terms of diagnosis, early presentation to the doctor in case of any problem is key. Principally, visual blurring, numbness, fatigue, or swollen feet point to microvascular complications that we are talking about. Or if you have any of the above risk factors we have talked about, you'll be taken care of by your doctor accordingly to prevent complications. The doctor will check your blood sugar, your HbA1c, your urine for any proteins, foot exam, as well as an eye exam will be done, as well as the rest of the system exam, so that if any other issue is picked up, it will also be addressed accordingly and promptly. In terms of management, optimal glycemic control is key, and this will be done by a multidisciplinary team with the patient at the center. My dear audience, as we approach the head of my presentation, I take this opportunity to put across to you that poorly controlled diabetes leads to complications that we've been talking about, that are expensive to treat, and they interfere with the patient's quality of life and can lead to death. So prevention is the key. In that regard, I advise you to avoid cigarette smoking and alcohol use. You go for your checkups involving your eyes, your kidneys, as well as your nerves with regular exercises, as advised by your doctor. For the ladies who fall pregnant, start your antenatal clinics early enough so that all these checkups can be done. Foot hygiene, self-regular foot inspection with appropriate footwear, timely medical attention for any complaints, and you are advised also to be compliant to the treatment that the doctors give you so that blood sugar control is optimized, and the doctor will also endeavor to take care of all those other complications that ensue. And as we conclude, my dear audience, this evening, I take this opportunity to reiterate and emphasize to you that diabetes is a very expensive disease to treat. Once all these complications that we are talking about come up, and it's a wake-up call and our duty for each and every one of us to know that prevention is the key. We optimize our blood sugar control. We listen to the advice that is given to us now by our doctors, so that we can be able to avoid these complications. I take this opportunity also to share my contacts that you can reach out to me in future for future communication concerning any health related issues that you want us to discuss together. Thanks a lot for listening to me this evening. I now can take questions. Thank you.